The Building Oral Healthcare Access BOHCA educational training program implements an extended service learning experience while educating and training dental hygiene students about the lack of oral health care, cultural competency, and social responsibility along the Texas-Mexico border region. The program demonstrates effective collaboration and partnership between an academic training institution and the community.
BOHCA is bringing an excellent opportunity for our patients and for the students to learn. Without this program, our patients, 60% of our total patients, would not have access to care, access to dental care.
I have worked with lots of different programs, and this is probably one of the collaborations in the last couple of years that I'm proudest of.
The BOHCA program has offered several things to our Gateway community. First of all, it's offered hygiene services to our adult population, services which we were unable to offer before.
We have 2 advisory boards made up of people that go to the clinic or have gone to the shelter or are participating in the educational center. And they have told us the biggest need is dental care.
The School of Dental Hygiene, the School of Allied Health, and the University of Texas have created a partnership with Gateway Community Health Center, and now we're adding the patients as partners to have this program be successful.
Let's try scaling that too. You think it's ready?
As director of the Building Oral Healthcare Access BOHCA service learning program, I am proud to say that the components that are essential are incorporated: the university, the community, and the students. Service learning consists of reflections by the students where they express and share their experiences. But most importantly, their feelings and the impact the service learning program has made on them as individuals and future health professionals.
I've seen students that have just fully evolved. They start out with this program with tons of fears. They have anxieties, they don't know the language, they don't know the culture. They may have never even been away from their family, but whenever they go down there, they come back and they've just changed so much.
During school, I developed a passion for serving the community, and I really had a desire to serve in a community health center. And when that opportunity came up, I just couldn't pass it up.
I wanted to learn more about, my culture, and I wanted to learn more Spanish.
I thought I would step out of my box and try something new, a place where I'd never been and knew nothing about, and it was curiosity that brought me there.
I didn't have to think about it. I just knew in my heart, yes, you want to go, I want to go. So I signed up to come and just without a doubt knew that I wanted to do it. And I don't know. I didn't really have this huge reason for doing it. Just, it felt right.
Definitely has reinforced our cultural competence class that we've taken, the lecture. It's just put it all in perspective.
Yeah, I was pretty excited. I came home, I was like, oh, we have the option to go somewhere, and yeah, it was great. A little worried about being so far away and school online, but it's been absolutely the best choice.
What better place to learn Spanish, especially dental Spanish, than to force myself into an environment where it was 99% Spanish speaking, which was Laredo.
Going into it, you feel a little scared, you're a little nervous, you don't know what to expect. I didn't speak the language, and it was never an issue. If the people in Laredo didn't speak my language, then I tried to speak theirs, they tried to speak mine, and somewhere in the end we understood each other.
It brought out the humanitarian in me, and it made me in touch with, with my feelings about underserved people and underserved community, and I know now that the public health area and the community services is something that I want to continue with throughout my career.
We have a very serious problem in our community, I feel. A lack of access for dental care for the people that we touch daily.
For me, the clinical experiences were probably the ones that impacted me the most and what I found most enjoyable. I really like just being in clinic working on patients.
A lot of our patients have chronic diseases, and so the hygiene students have a great opportunity to experience and learn about the medical issues dealing with hygiene and all the complexities involved in that.
Muy buena, tienen muy bien, explica muy bien y tienen mucha paciencia y me gusta lo del programa y la limpieza, está todo muy bien. Y no, pues estoy muy contento con todo el trabajo de las trabajadoras y le deseo suerte por la graduación que se va a graduar y es muy buena, es todo lo que puedo decir.
One of my very first patients, her calculus was very difficult. It was hard for me to explain to her what I was going to do, and basically we kind of had to feel for each other and just know that I was here and she was in my chair for 2 hours and trusted me. And she was very grateful for the time that I had spent with her.
To begin to touch the lives with this program of a simple thing of education, learning how to take better care of their teeth.
A lot of them taught me about who I am and how I want to be as a dental hygienist, how I want to treat my patients.
If I was able to find the perfect atmosphere to work in, it'd probably be in a community clinic.
One of the steer activities that I was able to participate in was a 3-mile hike along the banks of the Rio Grande River, where we got to look at green space issues like land erosion patterns and that sort of thing.
And we went to the herbal medicine hike with Mr. Tony Ramirez. The one plant that hit directly for us in the dental hygiene field was there was a plant that, it was called the toothbrush plant. Just the settlers would use it like a toothbrush, and they would brush their teeth and they would brush their gums with it and everything. And back then they didn't know, but they were helping with the periodontal disease.
Along the banks of the river, you'll see the people on the other side, on the Mexico side, fishing or tubing, and you just casually wave to them and tell them hi or hola, and you can't help but think, we're so alike. We live in different worlds and in different environments, but we all have the same goal. And that's to be treated with dignity.
We had the opportunity to take day trips along the Rio Grande. One particular trip, we did a water sampling. Our main purpose was to get in the water. We had different tools. We would check temperature, we would check pH, we would check the flow of the river. We wanted to see how fast it was flowing. And then we would get in, we would knock up some of the little critters, knock some critters off the rocks, catch them in nets, and bring them up, take them out, separate them, and we would look at them and see which ones were living in which different parts of the river.
One of the things, when I was thinking about the students coming from BOHCA and our first interview with Magdan, when we were talking how might this work from the University of Texas Health Science Center, I had a fear that it wasn't going to come about. And I didn't want to tell the people that we work with daily, the families, that we were going to have this program. And now I'm so excited to go out and tell them, one of the things that you were asking us for, that you told us that you needed more education about dental care, cuidado dental, it's going to happen. And it's with a collaboration with people from the University of Texas Health Science Center that want to come down and help us. And they want to come down and help us because they know that this community can teach.
The impact that the program had on me pretty much was just to not take for granted everything that I had. Just to know that they were so grateful made me kind of feel that I was a little bit spoiled, I guess, and that I took for granted a lot of the things that I have. But that completely changed me.
Through this experience, I got to see a lot of the things that I had only read about in textbooks, the issues of lack of access to care, but it was that much of a priority and that much of a blessing for them to receive this treatment.
And Mercy Ministries is very proud of this connection with the University of Texas Health Science Center and the Dental Hygiene School because we think it's going to help both. We're going to learn, and I think the students will learn.
One fond memory that I have of being in clinic at the South Clinic at Gateway is I was treating this man, and him and his wife would always come together. And the wife wasn't a diabetic, so she didn't qualify for the program, but I would still see her husband because he was diabetic. And here I would, be treating the little old man, and his wife would be sitting in the corner in a chair, and she would just hum. And I felt really comforted about that because, not only was she soothing and comforting him, but she was also soothing me too, because humming is a comforting sound. And I remember I specifically told myself, remember this moment, remember this moment.
I think the advice that I would give students after their BOHCA rotation would be to remember what they learned. One of the things that when they do come to our center, they're encouraged to ask as many questions as they want.
Advice that I would have for future participants is not to, I guess, have the kind of outlook that I had at the very beginning. I had the outlook like, oh gosh, at the very beginning it was frustrating. It was very hard for me to kind of adapt to everything. Maybe the first couple of days I was like, why did I even join? Why did I want to go home? I shouldn't have ever agreed to this. But I want them to give it a chance. I want them to, once they have that one experience that touches their heart, they'll want to stay forever. They just want to stay and, help them. And then it'll be hard to leave.
You need to go in with an open mind. You need to be flexible and, have a good time while you're doing it.
It's just enjoy the whole experience. Your patients, take the time to ask them questions and try to get to know them, and keep a journal. Write everything down, because afterwards you're gonna want to read and remember the things that you are going through day by day, and just to look back and be like, man, I'm happy. I'm glad that I went on that journey to Laredo.
Looking at the faces of the 4 students that are here now, they're never going to be the same. Never going to be the same. Therefore, those 4 women are never going to be the same. The lives of the people that they touch when they go back to San Antonio are never going to be the same. It's going to be a better world simply because they came here.
I just wanted to mention on behalf of Gateway and myself and the community of Laredo how grateful we are for the Allied Health Department at the University of Texas Health Science Center, the Department of Dental Hygiene, for go ahead and taking the initiative to bring this program to our community. I think the Department of Dental Hygiene has to be commended because they took a chance and they're helping our patients. And the students, furthermore, are also to be very much commended because it is difficult to be away from home, a place where you don't know the people, you don't know where you're at, and yet take that leap of faith to try to learn something and at the same time benefit the community immensely.
So I think it's just going to get bigger and better, and it's a win-win for all of us. It's a win-win, especially for the communities and the individuals and the families who really would not have this opportunity in Laredo.
Through BOHCA experiences, dental hygiene students developed an increased sensitivity to diversity, social, and cultural issues based on the need of the community. BOHCA provides an innovative and continuous learning process to train dental hygiene students in issues relating to health disparities and access to care. BOHCA offers the opportunity to promote critical thinking, effective communication, and training by connecting coursework with active involvement within the community.